Okay. Um, let me see this real quick here. Yeah, you guys can go over there if you want. Yeah. Okay. What is the top? You got everything in here? You guys need it. Here you go. Okay, guys. We're gonna do an in-service today on oral care. Oral care. Okay. And not just oral care, not just oral care, guys, but for residents that are actively dying, and they don't have to be in hospice, right? These residents could be just like actively dying, and then we're gonna try to provide a nice moist environment, right, for the oral cavity. What's happening is that when a patient is no longer eating or drinking, their mouth becomes really dry. Okay, and I think some of who in here has experienced a patient, dying in hospice. Right? Most of us, you probably, some of our newer CNAs probably hasn't experienced that. But there's a lot of things that are going on that we need to. I don't think there's a lot. I think there's quite a few things that's going on. Once you get kind of used to it, you're just kind of like. I was a hospice nurse for a long time, so I used to do teaching. I used to go to homes and I used to teach family members what are the signs and symptoms of actively dying stages. What do you need to do, when the patient is having, certain symptoms. And one of those things is trying to keep the patient's mouth nice and moist, right? Um, if you don't keep it moist, right, and this patient could be in bed for 2 weeks, for 3 weeks, right? A decreased, swallowing, decreased eating, decreased, drinking water. So it's dry, right? Everything is caked on, and it's a gross sight. Things starts to open up in your mouth, and it's not a very pleasant sight, to say the least. When you're factoring in also the smell, right? But you want this patient to be comfortable as they kind of expire on their last few days. And in order to do that, there's a couple ways to keep the patient's mouth moist. And if they're still able to swallow, obviously, we're going to do oral grat, right? Which is giving a little bit of liquid here and there. Thickened liquid, preferably, right? You remember in liquid form, you have the regular thin liquid, you have nectar thick, you have honey thick, pudding thick. Um, and so there's quite a bit of ways to thicken the liquid, and you want the liquid to be thick because as you are actively transitioning and dying, you don't have the ability to swallow all that great. Okay, so the thicker the liquid, the better control you have as an individual who's going out on your last days. Um, but unfortunately, a lot of these cases that we deal with is patients that's already like not swallowing, not responding, non-verbal, and so we're left with a few things. Okay. Um, there's two things here. There's a toothache, right? And there's also a glycerin swab. Okay. The difference is that this is dry. There's nothing here. It's just foam, right? And this one right here it has a taste to it, right? This one is specifically as sometimes they come in like different flavor, but this one is lemon glycerin swab sticks. Okay, they're moist inside. If you open it, it's foil, right, to keep it nice and moist. So just like that, right? This you can use for patients that are actively dying or for a short period of time, right? It activates your taste buds, and it has a nice flavor. I don't know how nice it is. Never actually.
Technically, they do make us do that in nursing school.
Oh yeah.
I know. I remember.
It's kind of actually it's kind of good.
Swab it. It's like
All right, it's got that lemon flavor. But yeah, it activates your taste buds. Okay. The problem with this, guys, is that if you use this for somebody who's not actively dying, it does dry you out more too. So if you had someone who has dry mouth and you think, hey, let's go and use this glycerin swabs on them, it's gonna make them even more dry because there's alcohol in here. Yes, ma'am.
What if they have thrush? Is that something that you use?
Yeah, you can use this with thrush if it's short period, right? Thrush usually lasts for 14 days or so.
And then T2A has that.
Yeah, and they have dry mouth and they're not really swallowing. You can use some of these glycerin swabs. Just make sure, be aware that these things will dry you up. So that's why we have things like chapsticks and stuff like that that's available for you guys. We have a lot of stuff here at Seacrest and the videos right here. You can use the chapstick for long periods of like dryness. somebody who has constant dryness, there's medication you can take like biotin to keep you dry, to keep you moist, right? Your oral cavity. But you can also use this to test right here. That's foam based, right? You can take up water, right? If they're thickened water, you can put thickened water here, okay, and or just regular water. You can put it here, and you can swab the patient's mouth, right? And you can also squeeze some of this out if the patient is having a hard time swallowing. Squeeze the water out. You can put it here, and I'm gonna have to physically show you this. So you take this, and you can you swab the inner part, right? The lip right here, right around. So this patient who might be actively dying is not able to kind of respond back. So you're literally going like this around, removing stuff out of their bacteria or whatever that may be, gunk that's on their medication, around the gum area. Okay, you throw it out. You don't want to. You have a bunch of this. These are cheap. They're like 2 cents, guys. Don't be afraid to throw it out and get a new one, right? And so you want to also dip it back and kind of rub around the tongue, right? The tongue has a lot of bacteria and is the main cause of a lot of bad breath. So if you're actively dying and it's dry and you're breathing in and out, that could be causing some of the pungent smell that's in the room. So get it moisturized with this swab sticks. You want to avoid like squeezing water in there, somebody who's actively dying, because that's gonna create more water. They're not swallowing anymore. So if you're squeezing that water in their mouth, right, they're gonna have more gurgling. They're gonna have more death rattles. Okay, so don't be afraid though. Okay, you're like, oh man, I remember John said if I use this, it's okay if you have a little bit of fluid in there. You can always reposition this patient to get some of that fluid out. You give more medication, get the fluid out, but you want to try to use as less of a fluid as you can for somebody who's actively dying. Okay, so squeeze it out. You can you squeeze it around the cup like this, and now you've gotten most of that liquid out. And then go around the gum and around the teeth and then the tongue. Okay, to get it moisturized. Okay, for somebody who's actively dying, obviously you're not. It's gonna keep their mouth dry after you swab them. A few hours later, is gonna because of alcohol. But you want to try to use this with this. You know what I mean? Like this kind of will get rid of some of the smell. Also, you get that lemony flavor. But for the most part, this is for somebody who's more awake. You want to activate your taste buds. For somebody who's actively dying, you really want to try to stick with the two steps right here. Okay. Again, this is a great way to get people oral cavity moist, but it's a drawback. It's for short periods of time. You don't want to use it for long periods of time. Okay. The other thing, yes, ma'am.
For people, a lot of people that are, they have all that mucus that is thick,
Yeah.
stringy.
Yeah. Okay. So you are gonna deal with patients a lot of times when the patient is actively dying. You can have a lot of like these death rattle, right? It's important you like reposition this patient in a way where their shoulder is down like this, and their hip and their right legs like that. So if you have gurgling that's going on, and your patient is kind of like back this way, you're gonna have more gurgling. So get him on the side. Use a pillow. Bring that foot up. Right, they're completely on the left side. They're completely on the right side, and that'll control a lot of your death rattle. Okay. What your nurse can also do is they have medication that can dry you up. You can ask for medication. Hey, do you have any meds that can control some of these, death rattle? Hospice specialize on that, on symptom management. Okay, so if you're doing your oral care and you notice that there's a lot of gurgling, you can ask your nurse, hey, is there maybe you haven't given it yet, but is there something that you give for this gurgling, this death rattle, right? She might say, I already gave it. And then there's sometimes too that you can do suctioning depending on where you're at. Here at Seacrest, we try to just keep that to the nurses to do the suctioning, right? Because it's invasive. And so there's two ways to kind of suction these out. You could go oral cavity, or you can go a little deeper in. There's tracheal suction that goes all the way down. So those are effective, but they also suction out a lot of your medication. So keeping with the oral care for patients that are actively dying, we have chapsticks as well, guys, to kind of keep the patient's lips, moist. But a lot of these issues should be taken care of with this right here, So patients that are difficult to deal with, they don't have to be hospice, right? You can always just put this in their bedside. Okay. The main reason why I brought some of these in here, guys, is because all these equipments right here are available for you guys to use. There's a basin, regular basin, right? And then you have your emesis basin right here as well. Okay. So all of these equipments you can use. Bring it over to your patient's bed. And the family members can use them. But it's just nice to have these equipments always available for oral care when your patient is actively dying. And these oral care supplies is not just for patient obviously in the hospital, it's for everybody, right? But I just gonna kind of go over here. We have these cups here for your dentures, and obviously this to soak the dentures in, toothpaste. We have the napkins here, and then you have your fixodent here. And if you have any other supplies that you feel that you used before that works for you, that works really well, and we don't have here, I urge you guys to talk to Viviana. You can even tell me, right? And then we will order it, right? If it works well for you and we've never seen it, I've never, and I feel like we can use it here, we can definitely implement that here. Okay, what are some of the things or concerns that you guys have in terms of oral care, right, for patients that are actively dying? Or what are some of the techniques that you guys have used that I didn't mention that you feel works for you? How about you, Don? How do you take care of your patient who's actively dying? What kind of oral care would you provide? Anything different?
Kind of, especially if they have a dry mouth and stuff and there's crusted, which you shouldn't get, like she said.
Yeah.
I try to, because this lemon glycerin, it kind of breaks down that crumbly stuff,
Mhm.
and then I go in with the clean.
Yeah.
But a lot of them, like I said, they have that, like the death rattle, but they
Yeah.
have all that. It's like
Yeah.
mucus and it's
Yeah.
thick,
Yeah.
and you gotta keep on, and
Yeah.
you end up using a lot of these.
Yeah.
But I take water and your mouthwash.
You use
because,
mouthwash also, yeah.
like you said, it holds a lot of bacteria on the tongue, and then I do this.
Yeah, the mouthwash can be drying as well, but if you're actively dying, you have a lot of smell in there, you can typically just mix this with water or whatever and kind of clean around the gum area and the tongue area. Okay. Be very careful with, like I said, be very careful with too much water. If you have this soaking and dripping in water and you're trying to clean the resident's mouth and they're already not, just make sure you're squeezing the water out. Keeping this moist but not wet and like dripping, because that can cause a lot of gurgling still. Okay. At that point in time when the patient is actually dying, you want to decrease the amount of liquid that they're taking anyway. The most of the liquids that are coming in is from medication, liquid morphine, Ativan, and all that stuff. So you don't want to be adding any more from your oral care. Okay. So
With the two sets on the glycerin swabs, is there one that's better to use before the other?
I would use them at any point in time. I mean, I would prefer this, to tell the truth, just because this has a drying effect. Again, this is for short-term use.
Yeah.
Um,
If you're using them together, is there one that should be used first?
I don't know. What do you guys think? I mean, what
do
would you
that
use
one
first?
to break
The
down
glycerin?
A lot of the crustiness.
You think it
and
breaks
then-
down
Yeah.
the crust? Okay.
But like you said, it's a drying active too.
Yeah.
And then I go in with this. This is what I do last.
Okay.
And I make sure that there's not, like you said, a lot of liquids.
Yeah.
because
So with the good thing about this, guys, is that you're not really dipping this on anything. It's already moisturized,
it
right?
starts it.
So you can just rub it around the lip area, around the gum area, and the tongue area, right? So, but if you're having issues with dry mouth and it becomes worse with using this, I would suggest you using this right here. Okay, use some of this chapstick as well. Unfortunately, if you are using a lot of oxygen, like non-rebreather or something like that, you want to try to use less of the petroleum-based, just because apparently it can cause more heat and fire and stuff like that. It can heat up the lip because this is petroleum-based. Okay, so but I don't think that's an issue. I've never seen it before. I've used a lot of these petroleum-based type of thing, and I've used a lot of oxygen in patients who are actively dying. I've never had any issues with fire or anything like that. But I always got to mention that because that's recommended. Okay. All right, guys. And I know you came in a little late, but we were just talking about a patient who's actively dying, and the two products that we recommend using is the pipettes and or the glycerin swabs over here. Okay. And and the technique on how to use them is around the gum area, all around, and then the tongue. Obviously, is important to get some of that stuff out. But just keeping moisturized. The most important thing is that you're squeezing this first. If a patient is actually dying, you get most of that water out, and then you can moisturize the oral cavity. Okay. This is a good technique, guys, not only for you but for family members. This could be happening at home, and you're just doing a visit, and you're teaching family members how to keep the oral cavity nice and moist. Okay, it can be uncomfortable. They're dying, but still, you don't want any kind of open sores in the mouth because it's dry. You know, so I've never been in a situation before where I was dying, obviously, but I think I've heard stories of people that like they know like they're dying and they can feel some of the pain, they can overlook. So can you imagine not getting enough morphine and Ativan and being awake through that whole process? So I've always been a proponent of a patient actively dying and make sure they get enough medication. Because sometimes these people who are in actively dying stage, they for whatever reason they come back and fight it, and they're like, man, I saw everybody there, and this and that, I saw this, and because I worked for a hospital for like 8 years, and you hear a lot of stories of your patients. When you get to that stage, it's very rare that you come back, but there's people out there that come back from the dead, basically, and they tell stories. So and one of the things that I know we're getting out of the whole issue here of oral care, but one of the things that patients lose last when they're dying is the touch, right? So when you're dying, make sure you're providing that touch, and I don't care if you're just a personal caregiver or a family member or whatnot. If there's nobody there and you're the only person there for that patient, you want to provide that touch for that resident, let them know, talk to them. I'm going to do oral care. Just because they're actively dying doesn't mean you just go in there and just kind of like do it in your mouth and not telling anything. Let them know what you're doing, and just kind of provide reassurance, because you never know, guys. We might all be there one day. You know what I mean? So you want to treat people right, because I want to have a good nurse taking care of me while I'm in that stage. Okay. All right, guys. Any questions or any suggestions on how to take care of a patient who's actively dying oral care? That was short and simple, but it's to the point. You know what I mean? So, hey guys, we'll go through another training later on that's specific to hospice care. But if you guys have a topic that you want to talk about, that you feel you need training on, just bring it up and then we'll talk about it. Okay, whether it be even hospice care and whether it's symptom management or teaching family how to deal with how to position, right? What do you need? What do you do after a patient dies? Is there a certain step that you do as a caregiver, as a CNA at home in skilled nursing? There's a certain way that you need to carry yourself, and there's certain skills that you need to know, and a certain communication that you need to provide. Even just sitting there and listening to family members and just sitting with them and not talking. You think that somebody you're sitting there quiet, you're like, I'm not providing a good care here because I'm sitting here quiet. It's actually active listening is more important than anything for family members that is in the process of grieving, right? So it's really important to just kind of sit there with family and understand that they're going through this grieving process. So those are things that we can talk about and how to handle those kind of situations. Okay. All right, guys, go and sign in, and that's it.
Okay, thank
The
you,
next
Tom.
sign in sheet right here. Okay, thanks.